Hi friends, let's talk about the field of medical transcription because having worked as a medical transcriptionist, I feel that I can certainly bring out my experience about this wonderful field of this medical transcription. Many guys reach out to us stating, what is the difference with medical transcription and medical coding? Is both the process same? And how about medical billing? So imagine if medical coding is a process, the process that is prior to coding is medical transcription, and the process that takes place after medical coding is medical billing. So what happens is this medical transcriptionist, so when I say as a transcriptionist, he's actually a medical language specialist because he knows his medical terminologies, he knows his documentation, aspects and the deficiencies that are there, and he is the one who is also constructing the documentation. How it happens is typically when a doctor is rendering a healthcare service by way of a clinical encounter, he would narrate all this services that he did to a particular patient immediately after the patient's encounter is over. Or sometimes even during the visit, the doctor themselves can record whatever services he rendered to a software. Okay, so this software or these recorded files, we call it as these voice files. These are being sent over to this medical transcriptionist. So this transcription as a word, we can break that down into like trans plus scribo, which means trans means across and scribo is a Latin word which means to write. So this person or this specialist actually he's going to convert the voice files to a written medical record. Because gone were the days where we used to maintain handwritten documents or handwritten notes. Nowadays, the insurance requirements have become pretty stringent. So every such handwritten note or this voice record needs to be converted into a medical record. We should all know that a medical record is not just a health record, it is a legal record. So tomorrow, if there is any problem, the patient can sue the doctor. In that case, the doctor will have to appear before the court with his unaltered medical record. So such is, the legality of maintaining these medical records. So whatever information that you maintain should be of utmost care and utmost diligence. And these are not just with healthcare sector, it is also the legal sector it is involved with. So practice of medicine does not end just with this medicine, but it also has its own legal aspects. So a medical transcriptionist, he is actually a specialist who listens to all these voice files and then he converts them into a written medical record. So usually they print it in the form of it actually becomes a printable or a printed medical record. Many people think medical transcription is synonymous with just typewriting. I'll tell you that's not the case. That's not entirely true. It is really a very difficult job, to be very honest, having worked as a transcriptionist and as a medical coder and also with medical billing. So I feel that to work as a medical transcriptionist is a very difficult and a tedious process, because I'll give you one example. The doctor might say patient inocuous. This was a statement which I was hearing from a doctor. Patient inocuous. You will not believe, I was thinking I was just repeating over this file over again and again and again. I was unable to decipher what this healthcare provider is coming to tell me. Then I came to know that this is actually what she wanted to convey. That patient is in no acute distress. So this is what the provider wanted me to convey, and this comes under this constitutional or the psychiatry aspect of the physical examination, the medical record. So you see, doctors of different countries pronounce differently. Take for instance, if you know this Tamil language, even Tamil language is spoken differently in the northern Tamil Nadu, whereas in Kanyakumari they speak differently, whereas in Kongu Mandalam they speak differently. So whereas the Madurai Tamil would be different. So with just one language, you see the vernacular, the way of pronunciation becomes different. So imagine in America, not just America, we have like 50 states, and on top of it, people from all over the world, a Chinese doctor will be talking these medical terminologies, a German doctor, a Spanish doctor, an African doctor, an Indian doctor. So see the way that they will be pronouncing. So it's really going to be very difficult, because a medical transcriptionist needs to understand the tone and the way they pronounce actually. Okay, and moreover they will also be specialists in certain type of specialties alone, because it is very difficult. So you need to know these medical language terminologies. So a medical transcriptionist is actually a medical language specialist. Just like medical coding, we also have a certification with medical transcription. So we call that as certified medical transcriptionist, and we have certain associations like the American Association of Medical Transcriptionists. So here people in India, not many of them are being like certified people, but still they are doing a wonderful job. So it is a hectic profession. It's going to require people of that caliber and dedication, because when you are going to work, your hands should type and your eyes should see the monitor and your ears will have to hear what this doctor is telling us, because the dictated notes will come via these voice files and you'll have to listen to it. And then you will not believe, your legs will have to pause. So it's like you are going to give this entire work for both your sensory and your motor system. Giving work for your eyes, your ears, and on top of all that, your brain. You will have to think what the doctor is trying to tell you. And even if one word you are unable to hear properly, if you are unable to understand, you cannot just go to the other word. So every word requires to be spelled properly, it should be understood, and on top of it, you need to know this grammar, the punctuation, where to put the semicolon, and where to put this full stop. So everything matters. So a medical transcriptionist is a very good documentation specialist, because he knows what is there in this medical record. And that's why if you see, a person who has his base with medical transcription is a wonderful person who can easily shine with medical coding, because you already know this aspect of this documentation. So you really become a wonderful medical coder, because you know where to look for into this medical documentation and what could be the documentation deficiencies. So tomorrow this would also help you in a bigger way to become like medical auditors as well. But what has happened is, with this transition of this America to this with high-tech laws and migration to this electronic health records and electronic medical records, now transcription has got a hit actually, because many doctors are preferring these softwares and they need to migrate to these EHR technologies. So because of this, they are taking shortcuts, because the EHR players, they provide the doctors with documentation templates. But again, not all of these documentation templates can be defensible in times of an audit, because sometimes there can be a note bloat and there can be over documentation. So when the work is being done by a medical transcriptionist, that's going to be a wonderful job, because they are actually going to type or print the information that's been actually being dictated by these healthcare providers. Okay, so what happens is, yes, on one side there is a declining trend, because the Bureau of Labor Statistics, which is a department under this US Labor Department, they have actually given a kind of a projection that there is a declining trend by 2% by 2029, because with this outcome of this information technology and high-tech laws and certified EHR technologies and EMR, yes, medical transcriptionist profession has taken a jolt. And I have also personally witnessed medical transcriptionists are losing jobs in Chennai, especially because of this shift to this information technology. But still, what happens is, it's only the majority of this US chunks of volumes have been reduced, but medical transcriptionists are still providing their significant service for United Kingdom and Australia and for the other countries. Okay, so though there is declining trend, but the transcription process as a whole highly needs to be laudable, because a transcribed medical record is a legal record, and if there is any errors, that will be actually being overseen or supervised by an editor and by a chief editor. And finally, the doctor will have to sign this medical record of this transcribed note. So this transcribed note definitely gives a full picture of the disease. No matter we are migrating to this EMR and EHR, but the work done by medical transcriptionists would be of a defensible strategy. So my advice would be like, it's not that I'm totally not favoring this information technology, but what is needed is that, the note bloat and over documentation aspects and the deficiencies in the documentation needs to be addressed, and this can be very well be done by the seasoned medical transcriptionist. So medical transcriptionists, again, it's my suggestion to them. So even if there is a decline, you can always shift to or migrate to medical coding as a process, because you guys have really a wonderful experience with this, documentation aspect of it. So you can become stalwarts and even trainers and training managers, because you already know this language of medicine, which you have been doing all these years. And certainly that is a feather in your cap, and this will certainly help you in this medical coding as an industry. Thank you very much for watching this video. If you have any comments, you can just post it in the comment section, and we'll be glad to provide you with our response.
You can contact us at 805-60-855-96-9962-791072.